Welcome to my channel. Thanks for visiting. Today is all about the treatment of syphilis. Our understanding of the treatment of syphilis will be enhanced when we know how the diagnosis of syphilis could be made. This link will provide the pieces of info about that. Also, the signs and symptoms of syphilis can be found here. Now, we must understand that penicillin is the main agent that we need here. Therefore, the history of allergy to penicillin is very important. Desensitization will be very helpful. As a matter of fact, I'll be talking more about desensitization separately. However, just briefly, even with desensitization, we need to get our rescue agent at hand. Probenecid will be helpful at the point. And probenecid, in addition to the penicillin G that we'll be using, will give us synergistic effect because probenecid will prevent the excretion of penicillin, giving us more level of penicillin in the plasma. You have an infectious condition and you need to use penicillin, but you are allergic, like penicillin is the best choice for syphilis. Well, don't worry, you can be desensitized. This could be done by an expert, and that could take place in the hospital or clinic, but rescue agents must be at hand. They can try per oral or intravenous route. They will start with slow dose, increasing it gradually until the expected dose is reached. But if there is immediate hypersensitivity reaction like anaphylaxis, Stevens-Johnson syndrome, toxic epidermal necrolysis, or erythema multiforme, it must be stopped and never again. It is not forever. If you stop using the penicillin after you have been desensitized, after some days or weeks or months, your allergy could return. But the better alternative is use another medication if it is available. Thanks for listening. Remember to subscribe to my channel. I appreciate it. Now, let's start choosing. If we are dealing with early syphilis, that is primary, secondary, and early latent, we can use penicillin G benzathine. Here, we are going to go for 2.4 million units, and that will be given intramuscularly once. But if the case is tertiary syphilis or late syphilis, then we will still use the same penicillin G benzathine given intramuscularly at the rate of 2.4 million units, but that will be once a week for 3 weeks. Now, if we are faced with neurosyphilis, instead of benzathine penicillin G, we will use Achios penicillin G. And this time around, it will be given intravenously at 3 to 4 million units every 4 hours for 10 to 14 days. We may choose to give it by continuous infusion, and in that case, we'll give 18 to 24 million units every day for 10 to 14 days. Some authorities will go for the same penicillin G, but this time around procaine, and they will give that intramuscularly at 2.4 million units once daily. They will do something different by adding probenecid at the rate of 500 milligrams per hour 4 times daily for 10 to 14 days. In other words, we will use these 2 medications each day for 10 to 14 days. All this will be applicable if we are faced with neurosyphilis. We have to be careful when we are dealing with different brands. Bacillin LA is okay for syphilis. The Bacillin CR is not okay for syphilis. There may be failure in treatment of a pregnant woman having syphilis. And why that? It might be because there's high level of treponema load, or because of the changes in penicillin kinetics. When there will be faster elimination and lower level of plasma concentration of the penicillin, and also might be as a result of no time enough for fetal therapeutic response. Variability. Some will still use penicillin G benzathine to treat early syphilis, that is primary, secondary, and early latent, but they will do something different from what I've stated. So they will not give it just once, they will give a space of 1 week and repeat the same dose of 2.4 million units. In the case of late latent, when the individual is suspected to get 2.4 million units weekly for 3 weeks, if you miss a dose within 1-2 weeks, that's fine, but greater than 2 weeks, you have to start all over. You start all over. Now, if the individual cannot tolerate penicillin, and we've done everything, but penicillin is just not the way to go, desensitization is not working or is dangerous, then we can go to the family of cephalosporins. Ceftriaxone will be helpful for us at the early part, that is primary, secondary, or early latent. We can give ceftriaxone intramuscularly or intravenously. You may choose 1 to 2 grams daily for 10 to 14 days. Or if we are dealing with tertiary syphilis, then we'll give ceftriaxone intramuscularly or intravenously 2 grams daily. Remember, the difference between this is you may choose 1 gram, but in this case, the tertiary syphilis, you give 2 grams daily for 10 to 14 days. However, we don't have the option of intramuscular route when it comes to neurosyphilis. In this case, we go for intravenous route only at 2 grams daily for 10 to 14 days. Amoxicillin may be employed, but not in neurosyphilis. Mostly it is limited to the early part, the primary, secondary, and early latent. In that case, we can give amoxicillin per oral at 2 grams with probenecid to help per oral also at 500 milligrams twice daily for 14 days. Doxycycline could be used, but not in pregnant women. So doxycycline will be helpful not in horrible syphilis, not in neurosyphilis. Will be helpful at doxycycline per oral 100 milligrams twice daily for 14 days, or twice daily for 4 weeks or 28 weeks in the case of tertiary syphilis. The last option here will be azithromycin. That is the very last option. If we cannot use penicillin, we cannot use ceftriaxone, doxycycline is contraindicated, we can grab azithromycin. At least we will not be looking at the affected person unattended to. So per oral 2 grams start will be the last option. Please, you can ignore what I've stated here. You may make use of it, but follow the protocol in your jurisdiction or contact your pharmacist. With that, I've come to the end of this short presentation as per the treatment of syphilis. Thanks for listening. Please remember to subscribe to my channel. I appreciate it.